you look on this handout, I want you to keep this. It says, second paragraph from the top, keys to performing PNF properly. We're gonna talk about those more tomorrow when we start working our diagonals. Okay, so keep this. This is good information. It just doesn't so much apply exactly to what we're doing today. We're gonna go to the second page, and it's restoring stability. So if I say stability, I hope you immediately think co-contraction, because that's what we need to have stability around a joint or around a body part, is you need co-contraction and you need muscle balance, okay? So there are two PNF techniques that help you restore stability, and they are alternating isometrics and rhythmic stabilization. Now, those of you who are out in the clinic might have seen rhythmic stabilization, especially done to the shoulder, where someone lays down and they put their arm up to the ceiling and the therapist comes over and starts patting and they're trying to hold steady. That is not PNF, rhythmic stabilization, okay? It's stabilization kind of, but it's not. It's just, for some reason, that term has just gotten popular and everyone understands what that means, but it's not PNF, rhythmic stabilization, okay? Lavelle, just because you have a chair right here, and I'm gonna steal it, do you mind coming and sitting right here for me?
Yes.
Okay, and I need you to sit kind of on the front of the chair so that you're not touching the back. Okay, one of the most common areas that we need really good stability is our trunk, and alternating isometrics is exactly what it sounds. I'm gonna have him contract his trunk flexors isometrically and then his extensors isometrically by giving him steady resistance on the front. So I want you to pull into my hands and relax. And then push into my hands and relax, okay? Now, if I don't let off easily, let's see what happens. Go ahead and push back hard as you can into my hands. 6, 5, 4, 3, 2, 1. Okay, if he didn't have good stability, he would fall back, okay? So you wanna make sure, let's do it again, push into me. Let's say 3, 2, 1. You just ease off. He will feel that and he will match it, okay? So you just go back and forth. You can do any body part. We could do shoulder. I want you to hold your arm right there for me and don't let me push it down. And relax. Now, don't let me push it up, okay? I'm just gonna pick two opposite motions around a joint, and I'm gonna have them contract isometrically in an alternating pattern, alternating isometrics, okay? Rhythmic stabilization has a rotational component to it, okay? That's the only difference. It's still an isometric, but there is rotation involved. Okay, sit up real straight for me. Wonderful. So I'm gonna put a hand here and a hand at his back. Don't let me twist you. Okay, so now we're getting those obliques. And relax. And I'll do the other direction. And relax. So could I do shoulder? Okay, don't let me push you back. Don't let me push you forward. Okay, as long as there's a rotational component, you're doing rhythmic stabilization. Okay, don't think you have to do just standing or just sitting. Think about somebody in half kneeling. Think of somebody in quadruped. Think of somebody in a tall kneel, okay? Remember, we talked before about our neurologically impaired patients. Sometimes we have to take them down a developmental level. They're not ready to sit independently. They're not ready to stand independently. And we're trying to work our way up to that. And maybe one of the problems is they don't have good trunk control. So how about if we go back down a developmental level? And can we do some alternating isometrics or some rhythmic stabe to start working on that trunk control.
Could you demonstrate quad?
Absolutely. Do you mind?
Sure.
Okay. Why don't we do tall kneeling first, and then we'll kind of work our way down. Do you mind being on your knees? Are you okay?
So, like this, or both knees?
Both knees down. Okay, and just standing up real tall. Okay. So again, I could do this here at the trunk, at the shoulders, or I could come down. Do you mind if I'm at your hips? Okay. I could do the same thing at the hips.
That's hard. Yeah.
It is hard. Okay. He could now go up to half kneel. So 1 foot up. Okay. Same thing. His base of support is a little bit different now. Okay. So this is hard. Okay. And if you were on quadruped, okay, we can do this a couple of different ways. Alternating isometrics in quadruped is really fun. Pull forward, push back, okay? And then if I want to do rhythmic stabe, some rotation, I'm gonna push down at the hip and up at the shoulder. Don't let me twist you. Don't let me twist you, okay? Again, I'm just showing quickly, you would hold these 6 to 10 seconds. Okay, I could do alternating isometric side to side at the shoulders or at the hips.
So then how do you know when to progress from each phase?
You mean which position?
Like, yeah,
You can get up.
like how do you know when to progress from one?
Well, if my patient couldn't stand, the position immediately before standing is half kneeling. If this was still too hard, I'd go to tall kneeling. If this was too hard, I'd go to short kneel. If that was too hard, it would be sitting.
Okay, so it's not about what they're doing in that position? Like it's not...
Well, alternating isometrics is easier than rhythmic stabe.
Okay.
Being able to use kind of every muscle on one side of your body in one direction is easier than controlling a rotation. Okay, so I will usually in each position start with alternating isometrics, and once they have that, I would then go to the rhythmic stabe. Okay, now this is about co-contraction. This is about them recruiting and using the right muscle with the right timing. If you spot weakness during this, then you would need to go and do strengthening, okay? But we're kind of looking at stability, either teaching that neuromuscular re-ed to teach the recruitment, okay, because that's what we use isometrics for, right? Is recruitment and endurance and getting the whole muscle to contract together in an effective way. If we see that it can't do that, then we might have to go and spend more time on that certain muscle group.
So these are 6-second holds?
Yeah, because they're isometrics, 6 to 10.
And then what's the rest of the parameters? How many times do you
At
do
least
that?
3.
At least 3?
Okay. So just take a couple of seconds, try a couple of maybe different body parts or a couple different positions, alternating isos and rhythmic stabe. And then tomorrow we will be doing PNF diagonals. Okay?